thank you to each of you for being here. I represent Tennessee, and as you all know, Nashville is the center of much of healthcare in this country, managing hospitals, and of course, many of our companies and our citizens are employed by companies that manage rural hospitals. And in Tennessee, 50% of Tennesseans are in a rural area. So we pay quite a bit of attention to what is happening with access to rural health care. And we do what we can to increase that access. And in my work as co-chair of the Rural Health Caucus here in the Senate, we spend a good bit of time looking at that. When I was in the House, I came up with legislation for telehealth. And nobody was interested in telehealth until COVID hit. And then all of a sudden, everybody was saying, let's get that bill and pass that bill. And of course, it went in under the emergency health order. And I've worked with Senator Crapo to try to decouple that so that we can continue with telehealth. In the behavioral health arena, it makes a tremendous difference. When I'm talking to our community health centers, it makes a tremendous difference. And we have one county in Tennessee, Hardeman County Community Health Center, which has access to a cardiologist through e-consults and ConforMed. Now, they've never had that access in this county, but now they do, and it is showing tremendous gains and benefit into this service area. So, Ms. Rich, let me just stay with you. If you would talk about very quickly how you all have used telehealth, and then why parity in that payment is important for telehealth.
Well, thank you for the question, Senator Blackburn. And certainly, telehealth was something we knew that we needed to implement. And certainly with the COVID pandemic, we implemented it basically overnight and needed to do so if we wanted to provide care to our patients. So telehealth has allowed us to reach our patients when they couldn't come into our health centers during the pandemic. But certainly now, it is another tool in the toolbox to be able to provide access to care. And it's wonderful because we have patients that have transportation issues. They live long distances from the health center. And again, it's another way for them to access care. In terms of reimbursement parity, I think that's going to be really critical as we move forward. It has become integrated into service delivery models at our health center, at other health centers, and patients need it.
Yes,
patients want it.
Need it. I have a rural health care agenda that I've worked on for the last 3 years. Senator Durbin and I have a bill that focuses on workforce and would incent even further than the National Health Corps, getting people into rural areas, healthcare professionals. Also, a component of it is on innovation in delivery of care, and the third component is something Senator Warner and I are working on for an appropriate national minimum to address the area wage index. And we think that that is important. You're not going to get innovation in rural health care without these things. And we think that it is so important. We're concerned about the closure of rural hospitals. Dr. Herman, I'd like to ask you about that. If you all are looking at this and then the way the community health centers are coming in and helping fill that void because we are facing closures.
We believe that no rural hospital should have to stand on it by itself. And I think many of the ones that are closing are hospitals that have had to stand by themselves. So we have hospitals within our system that if they were not part of a system would not be able to stand by themselves. But providing that integrated care that surrounds it, having whether it's a health system or another entity take responsibility for the care in the area, not just a particular community, I think makes a tremendous difference. From a telehealth standpoint, one of the challenges that we have is that we certainly don't want anyone to practice fraud from a telehealth standpoint. But I use the bird feeder analogy. Sometimes you're so concerned about keeping the squirrels out of the bird feeder that the birds can't get in either. And I think when we start looking at some of the regulations we're building around telehealth, sometimes it really impedes the provider's ability to care for a particular patient.
Thank you for that. I know I'm over time, but I am working on community health care access for veterans. And one of the components that we are working on right now is allowing these veterans to immediately access care in their local community. And just a thumbs up or thumbs down, would your facilities be able to handle veterans coming in, showing their card, getting that health care, and then our responsibility would be making certain that there is a way for you to bill that back quickly and, of course, be quickly paid, not 180 days out, right? Absolutely. Thank you.
Senator Cortez Masto.
Thank you. Coming from Nevada,